Hi Sharon, welcome back. It's great to see you again. And first of all, I have some great news for you. You've done the right thing by coming in to see us. After examining your x-rays and the results of the examination that we performed, I feel really confident that what you have is treatable with chiropractic. So the good news is you're at the right place at the right time. Now, because what you have is a chiropractic problem, as you may remember from the video that we had you watch yesterday, chiropractic isn't new, nor is it experimental. It has been the successful treatment of choice for cases just like yours for over 100 years now. In fact, the results have been so popular and so successful that it is now the second largest healing profession in the Western world. And what I think is most important for you to know is that in a study done by WebMD, where they took 2 million patients over 4 years, chiropractic was found to have a 95% satisfaction rate. 95%. What other medical profession can boast that they have that successful of a record? So you can feel confident that you've come to the right place for the solution of the health problem that you have. Now, one more thing that you might want to know about your choice in healthcare is that chiropractic is natural. And I know today we're in a very drug-dependent world. Our bodies have been made with this amazing healing capacity that's going to be superior to anything a man can create, like a drug. The body is better than drugs, and we have to rely on it. Have you ever wondered when you cut your finger and you have a little bit of blood loss but stops bleeding? It puts itself back together. In a short time, you can't even find where the cut is. The body naturally heals itself by a central control system called our central nervous system. It knows better than you do what it needs to be healthy. When there's no nerve interference, the body can better diagnose itself and heal itself. So the first choice of healing should be natural before we resort to drugs with their harmful side effects and risks of addiction, and even surgeries. Drugs have their place, so do surgeries as well, but it should be our last resort, not the first. All right, well, let's talk about what got you here. Let's talk about your condition. Why are you having this pain, and why do you feel the way that you do? First of all, your issue didn't start yesterday. You may have started feeling that pain, but it didn't start the day your pain started. Pain is usually the last thing to show up with these problems. This issue has been building up over time and has been the accumulation of a lot of events throughout your life. In fact, it started with the trauma of your childbirth. Anyone who's witnessed a child being born knows the amount of trauma that goes to the head, the neck, and the spine. And it doesn't stop there either. Think of those hundreds of spills, those falls, and even accidents that you've experienced as a child and as a teenager. And if you think about it, it's amazing that we live past 5 years old because we've taken all these falls and hits to our body. And yet all of our physical traumas as kids went untreated. The point is that we've needed chiropractic care since birth. And it would have saved you a lot of problems and a lot of the wear and tear that you're feeling now. Certainly, if you have any kids now, or will have them in the future, keep it in mind because they're probably going to live to be 100 years old. And you want them to have good mobility the whole time that they're alive. Now, if we look at these people lifting boxes, let's talk about the lifestyle you have. Sharon, it would be impossible to know the number of improper lifting and physical trauma you've experienced over your years alive. That's why I say it isn't just one event. You already have years in wear and tear already. And keep in mind, that's if you have absolutely no prevention, no treatment, no care, no efforts to change that wear and tear on your body. Now let me give you an example. We've all been to the dentist, but let's say you've never been to the dentist since you've been born to now. Would you have all your teeth? A lot of them would have fallen out by now. And through the years, you've experienced a lot of nerve damage and tissue damage, and it's been virtually untreated. So you're really fortunate that you're not in more pain than you are right now. Now keep in mind, as we've discussed, it's taken years to create this physical condition. It's not going to be corrected in a day. And I know we want that instant relief. But as an example, it does take time. So say we gain weight over 10 years. We think we should be able to lose it in 10 days, right? But you know that's not going to happen. It takes time. But we'll discuss more about this time portion as we get farther along. But first, let's talk about where you are right now. Let's talk about some of the findings of our exam and the result of that untreated activity. So we'll talk about where you are now. So your spine has been pushed and pulled out of alignment. This causes less flexibility, causing irritation, causing swelling, and also pinching the nerve that flow out in between those individual bones in your spine, called your vertebra. The medical term for this is a subluxation. So if we take a look at the chart over here, you will see some of the problems that occur from subluxations in those regions of the spine. I think you'll find it fascinating. The reason so much of your health is impacted this is because your nerves run from your brain, communicate to the rest of your body, and even to other organs as well. This is how your body knows how to function and to heal. So you came in here today with that low back pain, and look at some of the things associated with the nerves from that part of the spine. There's pain in the groin, affects your abdomen, as well as sending pain down the leg. That sounds familiar. That sounds a lot like your problems, doesn't it? See, with those nerves pinched, it's the same type of thing that we experience with our cell phone today. If there's an interference to that call, either the call drops or it starts breaking up and we don't get the full message. So what we do is we move to where we can get that full message and remove that interference. That is what's happening with your body and your central nervous system. There's a nerve interference and your body's communication is cut off. The result is pain and disease. So subluxations cause more than just back or neck pain. They can cause many other types of disease as well. When we remove that interference so the body can heal itself, you'll most likely experience better health in other areas of the body. Not just where you're having pain in your back, but it can also help with the pain that you have or the discomfort you're having with your abdomen as well. Does that make sense? Now, another thing I wanted to point out is that there's 4 phases of spinal degeneration. We have our near normal over here, mild, moderate, and the severe. Now I want you to think about this with a common disease that most other people know about, cancer. What happens if we never treat cancer? The longer you let this go, the more severe and the more severe your health problems become. So it's important to start treating and preventing any further stages of degeneration now. Currently, I place you at a stage 2 with your spinal degeneration. Do you have any questions about that? Okay, let me take you back. We'll show you your x-rays, and I'll also show you that posture picture we sent you yesterday as well, so that you can get a better idea of what I'm talking about. All right, let's head back.